So my personal approach, I would say, for doing work with CBT and families is I want to integrate the parents, the kid, make sure that we're taking a team-oriented approach so we can collaborate to really address whatever the clinical needs are kind of head on together, so they feel confident taking on their anxiety or other related issues. We like to make sure we do lots of psychoeducation so they feel confident knowing what anxiety is, how to tackle it, and then we do things like exposures. I love to do in vivo exposures so we can get out in the world and really face real life situations so they feel like they can handle that in their daily life. So I was working with a client who, she was 13 years old, and I was working with the parents as well, and she was coming in because she was really afraid of public speaking, getting up on a stage. She wanted to seem perfect to everyone when she would go up on stage, and so her passion was doing school musicals. And what we did was we did a ton of psychoeducation on anxiety, social anxiety specifically, so that she knew the ins and outs of her anxiety specifically. And then what we did was we worked on a ton of exposures, imaginal, in vivo, just to really get her used to that sort of setting. And we did exposures to lead her all the way up to being able to actually perform the lead role in her school musical, which was amazing to see, given that where we started was she could barely sing in front of parents even. So it was a great case to be a part of, and they were a great family to work with. So yeah, that was probably a good clinical moment, I would say, for my client.